Hello everyone, it's Chematic Med, and today we're going to talk about arachidonic acid pathway in NSAID-exacerbated respiratory disease. From the phospholipids of the membrane, under the influence of the phospholipase A2, arachidonic acid is released. Under the influence of the 5-lipoxygenase, leukotriene A4 is generated. Then it can become leukotriene B4, which will do chemotaxis and is pro-inflammatory, or it can become leukotriene C4, D4, and E4, which will cause bronchospasm and increase permeability. And these all, C4, D4, E4, and B4 are pro-inflammatory. Under the influence of the cyclooxygenase, it can be cyclooxygenase 1 or 2, prostaglandin H2 is produced. Prostaglandin H2 can be converted to thromboxane A2 or prostaglandin D2. These two will do bronchospasm. Again, leukotriene C4, D4, E4, B4, thromboxane A2, and prostaglandin D2 are pro-inflammatory. And prostaglandin H2 can be converted to prostaglandin E2 or I2 or prostacyclin, and with these two will do bronchodilation, vasodilation, and are anti-inflammatory. Medication that we call NSAIDs or non-steroidal anti-inflammatory drugs and aspirin inhibit cyclooxygenase 1 and cyclooxygenase 2 or COX or COX1 and 2 enzymes and inhibit the prostaglandin H2 release. Aspirin-exacerbated respiratory disease is a non-immunologic reaction that occurs when cyclooxygenase inhibitors, for example aspirin or other non-steroidal anti-inflammatory drugs or NSAIDs, promote the imbalanced production of leukotrienes over prostaglandins. So it is obvious, right? If we are inhibiting one pathway, all the arachidonic acid will go towards the 5-lipoxygenase pathway, and lots of leukotriene A4 and then B4, C4, D4, and E4 will be produced. A classic triad includes asthma, chronic rhinosinusitis with nasal polyposis and NSAID sensitivity. This is very important. Please remember this. Classic triad is asthma, chronic rhinosinusitis with nasal polyposis, and NSAID sensitivity. Thank you. Bye.